Dr. Rajesh Gokhale, Secretary DBT Government of India, also visited us for inauguration of startup at Kathua. Professor Vinod K. Singh, member of CSIR Society, who has been assigned the responsibility to mentor this institution. We were fortunate to receive him on a couple of occasions. Uh, one visit was pertaining to the review he was supposed to conduct, and the other visit was as guest of honor. He attended this international conference on traditional medicine and phytopharmaceutical. Professor P. Balram sir, ex-director IAC, Indian Institute of Science, Bangalore, in the scientific community. And we were able to get his consent to act as chairman of this research council of this institution, and we invited him for research council meeting. He was there. Dr. GNC, another prominent person, ex-CGI. Presently, he is serving as advisor to Honorable Chief Minister of Uttar Pradesh. He was there in Srinagar event. And Dr. G.N. Kazi, our previous directors, when he observed that the institution is doing some kind of activities, some aroma missions, some societal missions, some drug development, he himself offered that I will definitely visit this institution. So the scientific leaders, the policy makers, when they are there to supervise us, they are there to guide us. So we should just see for the opportunity to cultivate the science in better perspective. Resource-wise, if we consider the infrastructure, the building, we are fine. We have two campuses, one is in Jammu and other center in Srinagar. We have experimental station at different geoclimatic zones. So through this slide, I would like to just share that it was only during last month we acquired one 5-acre land at Leh, where we will be establishing the demonstration farm for map cultivation. This is the latest addition in our resources. So this slide, initially I thought I will drop because this slide indicates our deficiencies. We are operating with a strength of 31.85% of total sanction strength. If we consider scientific strength, the scientist strength, technical staff, admin staff, so we are under acute shortage of manpower. But at the same time, this slide also empowers us to do something. If we are doing such kind of activities, whatever R&D we are doing, whatever societal mission program we are implementing, if we are doing excellent with it 31%, so definitely the figure, the image will be totally transformed if we will reach near to 80 or 90%. So this slide has two parts. Left is during last 1 year, only 2 employees joined this institution. On this occasion, from my side, from CSIR Triple family side, I welcome these 2 employees. But the right side of the slide shows the recruitment processes we have initiated. I wish during next year, when we will be here to celebrate 85th Foundation Day, the positions we are just proposing to recruit, these will be filled. So this alignment of this slide will be reversed. Again, a couple of scientific divisions, scientific research groups are there. Like we have plant sciences division for bioprospection, infectious disease division, then pharmacology, then in PMC divisions are there, a couple of other divisions which are actively supporting the scientific work of these people. So a good balance is there. As far as preclinical drug discovery is there, all kind of support, the divisions, the analytical services, other services are available in this institution, though we are having very less number of scientists, that is only 68. A certain for my institution, we have ACSIR scholars, project fellows. So what I see, this slide shows the backbone of my research work. We have 271 project fellows at different levels. Beside this, we have good number of ACSIR scholars. So on this occasion, during last 1 year, from the last convocation to this convocation, 41 scholars were awarded PhD degree. So on this occasion, on the fourth foundation day of this institution, my best wishes, my greeting to these budding scientists. So if we consider the performance, we are comfortable as far as R&D projects are concerned, other grant in aid projects are concerned. Initially, I used to think if one project, one per scientist I can get. So from the kind of progress we made as far as projects are concerned, seed funding is concerned, other mission programs are concerned, we are just near to cross that ratio also. I am happy about this, and on this occasion I would like to share this information with our chief guest and guest of honor and other people. So whenever students work, scientists work, if they take any project for research purpose, so our focus is to generate IPR, our focus is to publish our work. So sir, from last more than 1 year, we have shifted our focus from publication to patents. This slide indicates that if we see from 2023 December to November 2024, so the number of patents we have filed, that is increased. And the publication, though we are maintaining the level of publication, the impact factor, everything is being taken care by our scientists and the scholars and researchers. But this is the good sign that we are moving towards filing IPRs, protecting our patents and IPR. That is very important because ultimately we are working for society, we are working for nation. Whenever we will be able to add some IP, we will be able to produce some novel drug molecules or formulations. That will be the ultimate contribution to the society. As I mentioned, a couple of major facilities are there, which are supporting facilities for drug discovery programs and other programs. We have GLP standard animal house. Beside this, fermentation facilities there, BSL-3 labs, CGMP facility. We are only the government organization which is having this CGMP facility. Beside this, we have NABL accredited QA lab. During last 1 year, another high-end equipment, high-end facility we have added, that is bioreactor, and still we are in process of augmenting these facilities so that we will be able to make our scientists self-sufficient as far as services from different corners are concerned. When I talk about the augmentation and certification of certain facility, we identified some different targets, and at the moment I am happy to share that our 2 facilities, augmentation of fermentation facility and GLP certification of animal house. These 2 facilities are at advanced stage. That's why I have made it in green color. A couple of other facilities are there. Definitely my people are on job, and definitely within a very short period of time they will be able to achieve this target also. Detail, specifically I would like to mention and share this with our guests and other people. I must appreciate Dr. M.K. Verma, who took this challenge. This facility was idle for last more than 3 years. So pre-inspection has been done, and he assured that during next 1 or 2 months, we will get certification for this DTI. CSIR, Indian Institute of Integrative Medicine, beside implementing mission programs, societal mission programs, the core mandate of this institution is to do drug discovery. This institution is a composite model of preclinical drug discovery. We are working for NC, phytopharmaceutical development, drug development, then nutraceuticals and different disease targets are there. Our people, the R&D core team is doing well as far as drug discovery in this institution is concerned. This slide is to just show the kind of progress we have made during last 1 year. So one NC is at phase 1, phase 2 clinical trials. Besides this, we have 5 phytopharmaceutical leads at different stages of preclinical development. So only during last 1 week or so, we were able to file the IND. I must congratulate the concerned team, Dr. Ajay and Dr. P.P. Singh for their efforts. Besides this, other phytopharmaceutical leads are there at different stages of development. This is a good sign as far as drug discovery in this institution is concerned. Besides this, we have a couple of nutraceutical formulations also. So definitely our target is to just take these technologies to market, and the private partners are there, the industry people are there who are in regular talk with our team in IIIM so that we will be able to take these leads forward. So this is about the pancreatic cancer lead, that is NC. So as I mentioned, our target is to put this molecule in market by 2029. Already IND has been granted. Phase 1, phase 2 clinical trials we are conducting after getting funding from ICMR. So we have planned and we have set the timelines to meet the target. The kind of work we have done, the kind of speed we have adopted during past, if this will continue, definitely by 2029, we will be able to put this drug into market subject to successful completion of phase 1 and phase 2 clinical trials and other clinical trials required to be done. From Crocus, the formulation has been developed, characterized, the clinical work has been done. IND